The biggest barriers, and I vividly remember this, is financial barriers, language barriers, cultural barriers. You're using medical jargon that's not appropriate to the person that you're speaking to. You have to combat misinformation. You have to promote confidence. You have to have community education centers, reminders, perhaps mobile clinics.
Welcome to the Bronx Health REACH Community Coalition podcast. I'm Mariah Bernzaloff, and I am hosting today's podcast. I'm the program manager of the Adult Vaccine Initiative at Bronx Health REACH, an 80-plus member community coalition launched in 1999 to eliminate racial and ethnic health disparities in the Bronx. In response to recent changes in the vaccination schedule policies and the list of approved vaccines, Bronx Health REACH brought together a group of distinguished experts for a panel discussion on July 30th to address concerns many community members had about access to affordable vaccines, vaccine ingredients, common myths, and other related issues. One of the panelists, Dr. Annie Bodoutchian, is dual board certified in family medicine and obesity medicine. She completed her residency at South Shore University Hospital, Northwell Health, and has been serving the Suffolk County community and its patients for over 25 years. She is currently a clinical associate professor at Stony Brook University. Dr. Bodoutchian spoke about the misleading messages about vaccine research and safety, and possible reductions in vaccine coverage by insurance companies due to changes in vaccine policies. So the first thing I was hoping to speak to you about, American Academy of Family Physicians has taken action in the past few months to reaffirm the critical role of vaccines in protecting populations with low vaccination and high infection rates. What are the new Federal Administration vaccine policies that cause you the most concern, and why?
So thank you very much for the question. And I actually have several concerns. My first concern is it sends a misleading message that the vaccines have not been adequately evaluated, or that they have unaddressed safety concerns, thus this leading to an erosion of public health confidence. My next concern is obviously insurance coverage and how that's going to affect the population. My next concern is this stratification of high versus low population. And again, this will greatly impact overall public health, as now you've got the low risk population who is now not vaccinated. They clearly don't live in a bubble. They're going to go home and spread to the high risk vulnerable groups. And my next concern is we're ignoring long COVID. This new approach does not address that risk, and anyone can be affected at any time. And we all know vaccinations can help reduce long COVID. And my final concern is the impact on equity. When you're setting restrictions and mandates, this could disproportionately affect marginalized communities, further exacerbating healthcare disparities.
Thank you. These were all excellent points, Dr. Bodoutchian. It's really discouraging to see and scary to think about what could happen with these changes.
Yep.
Especially since adults don't have the funding that we have nationally such as the Vaccine for Children's program, which started around 1994. So, we don't have the data, very limited data, and we also don't have, um, any funding.
Right.
So that's kind of scary to think about what could happen next. Just quickly, if a vaccine is listed as a physician and patient shared decision-making vaccine instead of being recommended by CDC, as COVID-19 currently is, will insurance companies cover it? What are your thoughts on that?
So I first thought this is a loaded question. And I say this because my answer is yes. And I say it with a little bit of hesitancy because in most cases, the insurance companies should. So if a doctor is recommending a patient be vaccinated with a COVID vaccine, and it's based on the patient's individual circumstances, and this is considered part of this shared clinical decision-making process, then the insurance coverage should be there. But I'm going to repeat, always check with the insurance companies first. Always have your doctor's office check with the insurance companies first.
Yeah, we have to advocate for ourselves too, because
Correct.
it's not always a guarantee.
Correct.
Thank you so much. I am going to ask you one last quick question.
Okay.
I heard a case about a patient in Florida being denied COVID vaccines for their insurance company, although they have immune compromising disease. Are you seeing any shifts in vaccines that insurance companies might cover other than COVID in your experience?
So let me answer the first question first, and then we'll talk about the shift. Regarding the Florida case, okay, apparently the pharmacies were reportedly unaware of the CDC recommendations allowing the immunocompromised patients to receive booster shots more frequently. Now, regarding the shifts in vaccines, if you practice law medicine long enough, you're going to see a lot of shifts, okay, as to what's being covered and not covered. But I'm going to tell you that with the shifts that we're seeing, we can certainly see reduced coverage by insurance companies.
What are the short-term or long-term effects of recent policy changes in the U.S. vaccine schedule and approved vaccine list on New York City community members' access to affordable vaccines?
We also have to talk about the long-term effects, such as budget cuts to community health centers, and to further hinder vaccination efforts. So that's another thing that's very real.
Yeah, and we really don't know. One of the possible obstacles is a lot of organizations that are providing educational health education support might have their funding cut, which
Hmm.
are providing that information in the community, um, or maybe more limited. Um, yeah, absolutely. Absolutely. With the recent outcomes from the June meeting, not recent, but during the June meeting for the Center for Disease Control and Prevention's ACIP Advisory Committee on Immunization Practices, the group that provides advice and guidance on effective control of vaccine preventable diseases in the US. Um, is there any concern about a delay in the rollout of routine adult vaccines in the fall of 2025? I'm thinking of possibly COVID. It sounds like flu won't be delayed, but does anybody know if that might happen?
The CDC is removing recommendations from, certain groups. They're not removing the availability of the vaccines itself.
Right, but if people don't have insurance,
Right.
or if their
Mm.
insurance doesn't. I mean, that's
Yes,
one of my concerns is that, if it's not recommended, then eh, the insurance company isn't obligated to
correct,
cover it, right?
correct.
What can communities do to increase these vaccination rates among adults and children during all of this? I mean, what suggestions would you have?
No one knows, but I am foreign born and foreign educated. I'm an immigrant. My parents were immigrants. And the biggest barriers, and I vividly remember this, is financial barriers, language barriers, cultural barriers. You're using medical jargon that's not appropriate to the person that you're speaking to. You have to combat misinformation. You have to promote confidence. Um, you have to have community education centers, reminders, um, perhaps mobile clinics, okay, vaccination drives, and interpreters. Now, with the phones having Google Translate, we shouldn't be missing the balls. When I was a kid, when we first came here, okay, but now today in this age, we shouldn't. And you have to speak to them in their setting, their language, for them to have confidence in you as their provider. Once they win the physician confidence, then you break down the wall and they trust you. Once you win their trust, it's easy.
To find out where you can get vaccines in New York City, visit the NYC Health Map. If you would like more information about vaccines, visit our webpage at institute.org/vaccines saves lives.
You've been listening to the Bronx Health REACH podcast. You can email Bronx Health REACH at bxhealthreach@gmail.com. You could find Bronx Health REACH on social media. For Facebook, Bronx Health REACH. For X and Instagram, BX Health REACH. And on Blue Sky, bxhealthreach.bsky.social. The views, thoughts, and opinions expressed and presented by our guests here on the Bronx Health REACH podcast are their own and do not necessarily represent the views, thoughts, and opinions of Bronx Health REACH and the Institute for Family Health.